Dr. Leisle, let's talk about white fillings, silver fillings. In terms of, I'm not even sure silver fillings are still done. Maybe that's a question which I shouldn't even ask.
Silver fillings are still done. They are very good. There are certain organizations and there are certain dentists that feel like silver fillings are something in the past and they may be a threat to people. That has never been found to be true. American Dental Association has always, they've done studies throughout the years and they've found there's never been a problem with mercury contamination from silver fillings. Anyone who says the opposite of that needs to check that out, because all the research materials that have been done for 20, 30 years have never found a problem. White restorations, America obviously is very aesthetic conscious. We like convenience, and in America we like aesthetics. And so white restorations are something that most people want to have in their children. On permanent teeth, white restorations as far as back teeth, I'm talking about back teeth. White fillings in front teeth are fine. I mean, obviously you have to have that. But in back teeth, on adult teeth, white restorations are fine, but you have to remember there's downsides. A white restoration will not last as long as a silver filling. I have some in my own mouth, silver fillings, that have lasted 30 years, 30, 40 years. And if you take care of a silver filling, it'll last, especially if it's small. If it's large, it won't last as long, obviously. But a white restoration can last 6, 7 years. It can go longer than that if you take care of it. But right where the white restoration meets the tooth is called a margin. And I go into that because that is the area where it's going to break down, and especially in between the teeth. So white restorations may look good, but they may not be the best thing for your child's mouth as far as back teeth. They don't have the compression strength as with silver restorations either. And so there are give and take. They cost much more than silver fillings. They don't last as long. So if you're willing to have them restored and repaired and replaced, that's all right. But you have to know those downsides beside the full picture of not just aesthetics.
So basically, number one, tell me, are silver fillings really silver, or they're also called amalgam filling? Is that the same thing? Silver filling, amalgam filling, is that the same thing or not?
Yeah, it is an amalgam filling. That's what we call it. I'm going by parents because I see parents day in, day out, and they call them silver fillings.
Right.
And yes, they are. It's actually called an amalgam. And the reason why it's amalgam, as the word implies, is it's a combination of materials. There's different silver fillings, different amalgams that are made of different materials, but they're all safe, number one. That's the most important thing, because some of the proponents that come against silver fillings, they say they're not safe. That's not true. It has never been proven. And so, whereas the white restorations can be a problem, if you have a white restoration that looks good on the surface and yet it's failing in between the teeth and then it leads to an abscess, I don't think that's very safe. See what I'm saying?
No,
I mean, obviously you can have amalgam fillings.
The purpose,
Exactly. So we don't want to just look for aesthetics. Each patient should have what is best for them, and some need white restorations, some need silver fillings, or a combination. I like to think that we're not all pigeonholed into one thing, but we can have multiple things being treated.
But the important point to get out of this, at least from what I think, is that the silver / the amalgam fillings simply, it was all just some blown up stuff. They're not dangerous. They're not going drip into the body. They don't poison you. They don't give you Alzheimer at the age of 12 or whatever it may be. It's just not there.
Right. That is right. But there are proponents of just putting white restorations in the mouth. That's the only way to go. I question, when I hear someone saying this is the only way to do something, I question their what they believe. They may have an agenda, and that could be a profit agenda. And so I'm not saying anybody's like that, but there are people like that, no matter what business is in. So I believe that you have there's just not one thing you do, one bag in your bag of tricks, but you have multiple ways of looking at something. I mean, that's what therapy is all about. You can't just have one answer for everybody.
Well, everybody knows that there are many ways to Rome, right? So why wouldn't there be many ways to fix a tooth, right?
Many roads. That's
And,
right. Even in the mouth.
Yeah. Well, you said something which probably, you do have a point. Here's the thing: when something new comes out, it doesn't mean that the old thing all of a sudden becomes evil.
Yeah.
But then sometimes maybe in enthusiasm of sales pitch, and not necessarily viciously, just believing that this is better, one can get overboard and makes the old thing evil rather than just like, look, there's a new thing and it has some advantages. Which one do you want? Do you know what I mean?
Exactly. Leave it up to the patient. That's what we're supposed to do. All of us professionals are supposed to, when you're a doctor, you let them have the treatment plan, the alternatives to the treatment plan, and then it's up to the parent to make a responsible decision, an intelligent, responsible decision, not trying to guide them one way or another, but, what's best for the patient, not what's best for me.
Well, but in order to do that, what's best for the patient, you of course have to guide them, and you have to kind of go, look, this is the thing. This is what happens here, this is what happens here, like you said. If you go with a silver filling, with a white filling in a certain area, it costs a little more and you might have to replace it again, faster. And if you're willing to do that, no problem. So it's kind of like that type of, a choice you let them.
There's one more point I'd like to make. When I have a child that comes in, let's say 6, 7, 8 years of age, they have permanent teeth in the back, and the parent would like to have white fillings back there, and yet the child has poor oral hygiene. There's food all over the place. I know those fillings. If I went to white restorations, they're going to fail. They can fail within 6 months to a year. And so I say, listen, let's get the silver fillings done first. As the child gets older, replace them with white restorations when the child is actually taking care of their mouth. But during the cavity-prone years, you have a child that is not taking care of their mouth. The white restoration is the worst restoration you can put in that child's mouth. And you're saving the parent a lot of money. For the child that has great oral hygiene and they have 1 or 2 little cavities, hey, do a white restoration back there, no problem. See, and so it's just make an intelligent decision here and thinking through the entire process of not just it looks good, but also what kind of oral hygiene, what kind of diet do we have,
Right. Well, wonderful. Very appreciated your candidness, straightforward telling us how it is, Dr. Leisle. Thank you very much. Bye-bye.